Hello, my name is Desmond Jenson, and I'm pleased to moderate today's webinar about the FDA's tools to address the youth e-cigarette epidemic caused by JUUL. We are at the Public Health Law Center, located in St. Paul, Minnesota. We've been a go-to resource for public health law and policy for nearly 20 years. We provide legal technical assistance, which includes resources and publications, policy drafting, and webinars like this one. All of the work we do is done in consideration of advancing equity. That means that we are focused on partnering with communities and organizations to use the power of law and policy in a way that addresses the social determinants of health and meets the specific needs of all communities, especially those who unfairly bear a greater burden of public health and other societal harms. Here's the agenda for our mini webinar. Now I'll turn it over to Natalie Hemmerich. Natalie is a staff attorney here at the center, focusing on providing legal technical assistance to tobacco control professionals and tracking the FDA's regulation of tobacco products.
Thanks, Desmond. In September of 2018, the FDA Commissioner, Dr. Scott Gottlieb, identified e-cigarette use among youth as an epidemic, and in December, the U.S. Surgeon General issued the same advisory. The most recent National Youth Tobacco Survey, or NYTS, has revealed that there has been a 78% increase among high school students who currently use e-cigarettes from 11.7% in 2017 to 20.8% in 2018, and a 48% increase in overall tobacco use among middle school students. These findings have led the agency to announce that it would take new, significant steps to address the e-cigarettes, including re-examining its compliance policy regarding flavored e-cigarettes. If you tuned into last month's webinar, you would have seen this slide, which we used to demonstrate that although many outlets have been reporting that JUUL maintains a large market share, that fact is not the most concerning part of JUUL's rise. It's that when you look at total sales, JUUL has single-handedly driven the entire market to new heights. What was once a $50 million a month industry in 2016 is now an over $300 million a month industry. Now this graphic shows in the light pink boxes when survey data was collected to inform the NYTS reports. As I said, the 2018 numbers have revealed that 20.8% of US high schoolers are regular e-cigarette users. But the pink box on the far right indicates when that data was collected, at the beginning of 2018. This circle demonstrates that the market has continued to soar since that survey period. All this leads us to conclude the 20.8% figure is not a ceiling, and these figures are likely to continue to rise. For another perspective on how astonishing the 20.8% number is, let's look a little closer at the 2018 NYTS data for high schoolers. In 2018, e-cigarette use by youth is higher than use of all tobacco products combined for both 2016 and 2017. It's not just that we've reversed course on e-cigarettes, it's that this epidemic has completely derailed the reductions we have seen in youth use of all tobacco products, period. To that point, any tobacco product use by high school students has skyrocketed to the highest level we've seen, not only in the last 8 years depicted here, but is the highest in 15 years of survey data. And if you look closely, you can see we have lost ground in nearly every single product category. But by far, e-cigarette use is driving this increase. The one place we've not completely lost ground is cigars. But when cigar use is broken down by race, use has increased for both Black and Latinx high schoolers. All this information makes one wonder, how did we get here? How did this become an epidemic? What could have been done, and what can we do now? Before answering those questions, it is important to recognize that the Public Health Law Center and other key public health organizations have repeatedly and continuously raised the issue of the holes in pre-market review that could cause harm to public health. Now we are seeing our fears realized in the form of the e-cigarette epidemic, and it is up to everyone to address this epidemic in an effective and decisive way, and that includes the use of pre-market review. The FDA was given the authority to regulate tobacco products through the Family Smoking Prevention and Tobacco Control Act of 2009. But initially, the agency was only given express authority to regulate cigarettes and smokeless tobacco, and so only these products were subject to pre-market review. Although the FDA recognized the need for regulating e-cigarettes in 2009, it wasn't until 2016 that the rulemaking process was complete, deeming all products made or derived from tobacco subject to regulation with an effective date of August 8, 2016. Which is the first day that the FDA could impose pre-market review on those products. The black line here indicates that effective date and demonstrates that the FDA has had the authority to regulate products like e-cigarettes, cigars, and shisha for the past 2.5 years. Why this date is so significant is that the FDA possesses an incredibly effective tool to address the e-cigarette epidemic. This tool, called pre-market review, makes the FDA the gatekeeper of the tobacco product market. This tool gives the FDA the power to determine when products are allowed to be sold to consumers. The intention for pre-market review for tobacco products was to operate much like pre-market review for drugs or devices. For example, before a drug company can market a new drug, they must gather all the necessary materials to demonstrate effectiveness and safety and submit them to the FDA. Then the FDA reviews those applications and, in the most basic sense, either denies or approves it. Unlike the process for drugs, thousands of tobacco products already existed on the market at the time of the Tobacco Control Act and at the time of DEEMING. So the FDA, understandably, decided to exercise something called enforcement discretion, meaning the letter of the law is that on the effective date of DEEMING, without enforcement discretion, all newly deemed products would have been on the market illegally because they have not received marketing authorization. The FDA announced the use of enforcement discretion at the time of deeming and established a timeline for reviewing all these products. I'm going to pause for a moment and give an example to better explain enforcement discretion. Essentially, enforcement discretion is used when it makes more sense to do something other than what the actual rule or law is. As an example, parenting and bedtime. Let's say you're a parent of a toddler and you set bedtime at 7:30 p.m. This works, but then special circumstances may cause you to make an exception to the bedtime rule, like after-school activities or movie night. Additionally, you may set bedtime earlier if your toddler skips a much-needed nap that day. These are examples of when you, as a parent, use enforcement discretion around bedtime. If you continue thinking about the bedtime example, the original dates as proposed in the deeming rule would be an example of enforcement discretion as well, like pushing bedtime back because of a family obligation. This means that on the day deeming was finalized, August 8, 2016, the technical rule was that only products with marketing authorization from the FDA could be on the market. Because the FDA couldn't even accept applications until August 8, 2016, and with the sheer volume of products on the market at the time, the FDA exercised its enforcement discretion. That means that all e-cigarettes that were on the market on the effective date of the deeming rule would have had until August 8th of this past year to put in applications to remain on the market. The FDA would have had 1 year to either authorize or deny those applications, and anything without an authorized application would be removed. August 8, 2019 would be removed on August 8, 2019, as in less than 6 months from today. Everything on the market in the white period has an affirmative marketing order from the FDA. Another important note is this is only the process for products that were on the market on August 8, 2016. For products entering the market after that date, all of those products must have pre-market authorization from the FDA before introduction into the market. After the final deeming rule, there was an election and the administration changed, and with that change came a new FDA Commissioner with a new way of approaching commercial tobacco. In July of 2017, the FDA announced a new comprehensive regulatory plan. As this plan rolled out over the months, it included information gathering about prohibiting flavors in all products and reducing nicotine in combustible tobacco products to non-addictive levels. These steps were monumental and bold and have the potential to have an incredible impact on public health when these rules become finalized and the FDA begins enforcing them. That being said, the rulemaking process would optimistically take at least 6 to 10 years to finalize and enforce. We are in an epidemic now. Not as well known at this time, the FDA also announced that it was going to further delay the dates that it would require newly deemed products to adhere to pre-market review provisions. This is that new timeline. Now, instead of already being past the deadline for e-cigarette products to submit their applications to the FDA, and being less than 6 months from the date when all products either have a marketing order from the FDA or they are removed, manufacturers do not even have to begin putting in applications until August of 2022. Instead of being mere months away from FDA action on e-cigarettes, we are over 3 years away from the deadline to put in an application. 3.5 years is a long time to wait when we are at a crisis point now. The other concerning part of this announcement is that the FDA no longer identifies a deadline for itself to make decisions on these applications. Instead, products will remain on the market indefinitely until the FDA makes a decision. That's why there is no white on the lower timeline. To put this into context, the FDA similarly has had no deadline on certain applications for cigarettes and smokeless tobacco, and now, almost 8 years after those applications were submitted, there are over 1,000 applications, each one representing a product on the market, without final FDA action. Another important outcome of the lack of a deadline for review is that there is no incentive for the industry to get in applications as soon as possible. Under the previous timeline, there was a time when you may not be able to sell your product if the FDA hadn't had a chance to review the application. So the applicant had an incentive to get their application in as soon as possible to try and be the first product approved. Under the new timeline, it's the opposite. It creates an incentive to be the last application on the pile so that the FDA takes longer to review, and even if you ultimately have your application denied, you get to remain on the market that whole time. Since the July 2017 announcement, as I've said before, new data has been released that e-cigarette use among youth has skyrocketed to epidemic levels, and this change was largely driven by JUUL. The Truth Initiative recently released survey data confirming that 9.5% of youth and 11.2% of young adults have ever used JUUL, and that youth have over 16 times greater odds of reporting current use of JUUL compared with those in older age groups. Another important note from the study is that the differences between ever use and current use, defined as use in the last month, for JUUL users over the entire study population are relatively small. Why this is particularly concerning is for other e-cigarettes and for combustible products, many people will try those products at some point in their lives, but not become current users. The small differences in these numbers for JUUL indicates that many people who ever tried JUUL become current users. So going back to our previous timeline with the current deadlines. Here's where JUUL enters the market, and it's before deeming, which means that it is in the group of e-cigarettes that have until August 8, 2022 to submit an application to the FDA for authorization. It should be noted that in addition to the harms caused by JUUL, knockoffs like My Blue and View Salto are being sold, and these knockoffs enter the market post-deeming and never received an affirmative marketing order, which means they are definitely in violation of the Tobacco Control Act. These products were never granted any type of enforcement discretion and are absolutely required to have submitted a pre-market application and receive authorization before selling these products in the U.S. We do know that the FDA has sent letters asking the companies about these products, but there has not been any public reporting on any action taken, and these products remain on the market. Because the FDA is not stringently enforcing pre-market review, you may wonder what actions have been taken. The FDA has announced many targeted actions on JUUL, including collecting information, sending warning letters about certain flavored products, and a raid of JUUL headquarters. If you missed last month's webinar, I recommend you watch it. It's archived on our website at publichealthlawcenter.org. In that webinar, we talk about the JUUL Blitz, which we know, despite being framed as a targeted action to address JUUL, did not even mostly involve JUUL products. We just passed 3 months since the FDA made what was characterized as a big announcement of their intentions. Included in that announcement was the FDA's intention to take a hard look at internet sales, to consider revisiting the extension of the pre-market review deadlines, to think about what can be done to move flavored e-cigarette sales to adult-only in-person locations, to move forward on addressing flavors, to submit a rule banning menthol and all combustibles, and to continue to hope that manufacturers will voluntarily take measures to address the epidemic. It is true that in these current circumstances and with this current administration, where the energy is towards deregulation, the FDA can feel like its hands are tied on taking strong action to address the epidemic. However, big tobacco has never been a trustworthy industry that can be counted on to take voluntary action that would harm their profits. In fact, Altria has played the public relations game by announcing that they would stop selling e-cigarettes entirely, conveniently leaving out the fact that their e-cigarette brands represent only a nominal portion of their business. And then they turned around and bought a significant stake in JUUL, which is by far the most popular e-cigarette brand there is. Commissioner Gottlieb sent them a letter saying how disappointed he was in their behavior, but no other public actions have been taken. Back to the bedtime analogy. Let's say you plan to let your kids stay up later than bedtime for family movie night, but then your kids are misbehaving and you decide to reinstate the 7:30 bedtime. This is the parallel to what the FDA could do with e-cigarettes. Like I said before, because on the day of deeming, all newly deemed products could have been removed from the market, only enforcement discretion allows the products to remain. Now the FDA can change its mind immediately without formal rulemaking. In the bedtime example, circumstances have changed and bedtime is back in force. In the case of e-cigarettes, things have changed. We are now in a crisis with the use of e-cigarettes at epidemic levels that could spur the FDA to change its course on the use of enforcement discretion of pre-market review for e-cigarettes. What could the FDA ending or changing enforcement discretion look like? There are two primary approaches the FDA could employ. Either ending enforcement discretion and thereby removing products from the market that have certain characteristics, or removing products if the industry does not voluntarily comply with restrictions. To that end, the FDA has the authority to remove some or all newly deemed products until they have submitted applications to the FDA and receive authorization to re-enter the market. They can also end the use of their enforcement discretion that allows flavored products to remain on the market. They can remove products from the market that distribute to retailers who allow those under 18 to enter, or those that sell on the internet. They could also end the use of enforcement discretion for products with other characteristics unique to JUUL and JUUL knockoffs. For example, by removing products from the market that use nicotine salts or deliver a level of nicotine to the user that is above a certain threshold. The FDA has nearly endless options to use pre-market review in a way that systematically addresses the threat posed by the e-cigarette epidemic and JUUL. It just needs to use it. The steps that the FDA has already taken have not been nearly enough to prevent or end the epidemic. And some of the measures they've announced an intention towards, like eliminating flavors or menthol, which would have immense positive impacts on public health, especially in addressing health disparities, could take years to implement. What is important to remember is that FDA intentions should not inhibit local, state, and tribal action on JUUL and e-cigarettes. In fact, we know that JUUL has been playing the public relations scramble lately, in efforts that look like a page right out of Big Tobacco's playbook. JUUL has begun putting a lot of effort and finances into influencing and weakening state, tribal, and local commercial tobacco control. They've hired many lobbyists to push their agenda, as many as 20 in a single state. They've written and pushed for language in several states with problematic marketing restrictions that may be a backhanded method for inviting legal challenge. They have hired key former FDA and CDC workers. They have used youth-centered tactics and images to sell their products. They have taken out full-page ads in newspapers to buy goodwill. And they have even tried to entice high schools into implementing self-serving education programs. And these similar education programs backed by big tobacco were described as at best ineffective and at worst increased teens' propensity to start using tobacco products. JUUL is hip to the fact that any action by the FDA would be slow, and those working in state, tribal, and local commercial tobacco control need to be too. Localities, states, and tribes have many policy options that can address JUUL. For example, banning the sale of flavored products or limiting them to adult-only retail outlets, banning internet sales within a state or reservation, raising the minimum legal sales age to 21, and restricting the redemption of price promotions or coupons at the point of sale. The epidemic is a crisis now, and it's all hands on deck. The FDA needs to use pre-market review to its fullest potential to address the reprehensible actions by e-cigarette companies like JUUL. And at the same time, FDA action or inaction cannot stymie state and community-driven action that can have a huge impact in addressing the epidemic. If a state or community were interested in any of these policy actions, the Public Health Law Center can provide legal technical assistance to achieve those goals. And our FDA project team, Desmond and myself, are happy to address any federal regulatory questions you may have.
All right, thanks a lot, Natalie. And before we start answering questions, and we've got a lot of them, feel free to keep sending them into the Q&A panel. We'll get through as many as we can. I apologize for anyone who's having audio issues. Our tech people aren't really sure exactly what the problem is, but we're trying to do the best we can. If you didn't quite get the information on how pre-market review works, we just released a fact sheet. You can see it up on the slide here, and it's on our website for anyone to check out right now. But let's start getting to questions. The first question is, are there any cessation resources available that are focused on youth use of JUUL?
Yes. While the FDA is still working on best practices for youth treatment of e-cigarette addiction or nicotine addiction in youth, the Truth Initiative has just recently put out resources that anyone can go to try to address these issues.
Excellent. Another question, because the FDA isn't taking JUUL's products off the market, what can states do to keep these products away from kids?
In addition to the policy initiatives I mentioned, states can focus on what is happening at the local level. We know that JUUL and Altria are pushing tobacco 21, and that should make states take a hard look at the language that they're pushing and make sure that it does not have harmful provisions in it, like preemption of local action and also provisions that would address the possession, use, and procurement by youth.
Yeah, we've definitely seen a lot of that in the past, particularly from big tobacco companies. So it's something to be aware of if JUUL and Altria are lobbying in your state, which is, as Natalie said, almost every state in the union at this point. Here's another question. What can the public health community do to get the FDA to start using pre-market review?
Desmond, you want to take that question?
Sure. This is a tough one. Normally, the FDA will accept comments on rulemaking actions, and pre-market review, as Natalie said, is not rulemaking, and it's something the FDA can sort of change course on whenever it feels like it. So, but that doesn't mean that reaching out to the FDA, contacting them, is ineffective. You can certainly send a letter to the Commissioner, to Director Zeller, to tell those people how concerned you are about the products you're seeing in your communities and how easy it is for youth to acquire e-cigarettes and how prevalent they are, of course, particularly JUUL and similar products. The other thing I think that's worth mentioning is that public health groups did file a lawsuit challenging the FDA's reworking of pre-market review. Litigation takes a long time, obviously, so that lawsuit is still pending. But that action has been challenged in court. If there were decisions quickly, we could see a court compel the FDA to roll some of those dates back to something that's a little closer than 2022. But we haven't seen any decisions yet. I think we have time for one more question. And unfortunately, there were a lot of great questions we didn't get to. But this question is specific to menthol, which is part of the FDA's regulatory plan. Didn't the FDA already collect comments on menthol in 2013?
Yes, they did. And they are announcing that they will continue that process or continue the rulemaking process. Desmond, do you want to add anything more to that?
Yeah, I mean, it's something that we have been engaged with the FDA on for a very long time. I mean, going back all the way to 2012. We filed a citizen petition with a lot of our partners and the other national tobacco control groups that everyone knows. Filed a citizen petition requesting the FDA to remove menthol from cigarettes. They subsequently, after releasing a big scientific report, issued what's called an advance notice of proposed rulemaking to accept more comments on the issue of menthol. There's a TPSAC report, a Tobacco Product Scientific Advisory Committee report. The FDA has its own scientific report. And then, of course, as people know, the most recent advance notice related to flavors also specifically asks questions about menthol. So there's no shortage of information at the FDA regarding the impact of menthol in cigarettes and the impact on public health. So we would love to see the FDA actually propose a rule and really hope that that happens soon. So again, we didn't have time for all the questions, but I want to thank everybody for their participation today. Look for more webinars from us in the future.